right, y'all. So while we wait for the teach-in to start, there's going to be some polling questions that pops up on your screen. Also with translation, if y'all need support with translation, feel free to click on the translation box under Zoom. Go ahead and click translation. If you are looking for translation in Khmer, go ahead and click French. And for Spanish, go ahead and click Spanish. So y'all are gonna see some polling questions come up on your screen. Feel free to answer them the best you can. No responses. Everything is a learning process. All right, so the first question, is it true that after receiving a vaccine, you can still contract COVID? Scroll down to question 2. Because the vaccine has RNA in it, it will change your DNA. True or false? Number 3, if you catch COVID once, can you get it again? True or false?
You can do it on the computer, Mom?
Right, so folks are just joining us. We are doing a quick polling question, true or false. If y'all have that on your screen, go ahead and fill those out, fill those polling questions out. I see if you scroll down more, I see question number 5. Is there a microchip in the vaccine? True or false? So we got question number 6. Can youth contract or carry COVID-19? True or false? See, folks are already entering their names in the chat. That's awesome. Welcome, everyone. Welcome. We got 68 participants tonight. So we got a full house. Okay. So welcome, everyone. Thank you for being here today. So just some quick logistics on technology. So we are streaming the event in 2 different platforms tonight. So the first one is going to be over Zoom, and the second one is going to be over Facebook Live. So we want to give a special shout out to our interpreters. We have Aldo that's going to be interpreting in Spanish tonight. And we have Bo, who's going to be interpreting in Khmer. So if you all need translation, just navigating Zoom right now, feel free to, on your bottom Zoom button, you could hover over translation or click more, and then you see translation on your screen. So if you need translation in Khmer, go ahead and click French. And if you need translation in Spanish, go ahead and click Spanish. Yeah, so and then on Facebook Live, y'all already know, if you all have questions, feel free to add the questions in the chat box, and our tech team will do the best we can to help address that. Is that cool? All right, so again, hello everyone. My name is Amy. My pronouns are she and her. I am the field organizer with My Girls in Action. And tonight, Long Beach Rising, a coalition that consists of Long Beach local organization who promotes civic participation, alliance building, voter engagement, community organizing amongst communities historically marginalized from the political process. We're here to join forces and host a COVID teach-in for you all tonight. So we know that our communities keep us safe, right? And our communities give us mutual care. And we want to make sure that our communities have the resources we need to help empower us through these difficult times. We understand that there's tons of questions about COVID-19, vaccination. And tonight, we hope that you all learn something new, pass on the knowledge, because an empowered community with the right information will help debunk misinformation. So let's give a shout out to the local organizations in Long Beach Rising Coalition. So we have California Faculty Association, Long Beach chapter. We have Clergy Laity United for Economic Justice. We have Khmer Girls in Action. We have Long Beach Coalition for Good Jobs. We have Long Beach Forward, Long Beach Gray Panthers, and we have Long Beach Resident Empower. We have Los Angeles Alliance for New Economy, and we have Long Beach Area Peace Network. And we all in the house right now, y'all. So shout out to all the groups and all the organization. Feel free to write your name, write your organization and your organization handles. So that's so folks can introduce meet you all too. So I'm gonna be your MC for tonight. And since I got to introduce myself, I definitely want you all to also introduce yourself. I know folks are already writing their names on the chat. So if y'all can all write your name in the chat, write your name, your pronouns, include your organization, the city or what district you reside in. So go ahead and take some time to introduce yourself in the chat. Cool, Myra, I see you. Awesome. Awesome. So before we get started, I definitely would like to take a moment to acknowledge the lives of those lost before and during the pandemic, right? So Black, Brown, Indigenous, API,
and communities of color has been most impacted by this pandemic, whether it comes to healthcare access, housing crisis, education, economics, environmental impacts, being victims of violence, or high chances of getting exposed, right? The Long Beach Coalition, we stand in solidarity with low-income communities of color by building community awareness, knowledge, leadership, and power. And I also would like to take this opportunity to acknowledge that we are on sacred land. So Native communities remain at the forefront of the movement to protect Mother Earth and the life it sustains. So it's important that we raise awareness about Native history and that are often suppressed and forgotten. So in the chat, there's going to be a link. And the link will show you, will help you locate what Native land you're in. So feel free to write your location in that link, and then it will show you what Native land that you're in. And let us know in the chat what Native land you're in. Like right now I'm in Tongva land, right? So yeah, so y'all will see the link in the chat, and then feel free to write that down. Cool. All right, so and then we know that COVID-19 is a huge health crisis in our community and nationwide. And we ask our community members that are joining tonight in the teach-in to be kind, especially in the chat box, right? As we're doing the best we can to help educate and empower our community. There is no right or wrong questions. Always remember to throw glitter, not shade, right? And then remember to practice self-care, right? While you're in the meeting. So we got dope guest speakers here tonight. We have a panel, right? And we're gonna be doing Q&A. So how many, are y'all ready to get started with the teaching? Woo! All right, cool. So I would like to introduce our guest speaker, Kelly Colopy, the Director of the Health and Human Service, who will be presenting on COVID-19. So everybody give it up for Kelly, y'all.
So hello, everybody. We're actually, Dr. Davis and I are splitting the presentation. And so Dr. Davis is our city's health officer, and she is going to start out with some slides, and then I'm going to follow up with additional information. So I'm turning it over to Dr. Davis for the slides, and then I think you're going to share your screen, James, right?
Yes, I can share my screen unless you prefer to, Dr. Davis.
I'm fine with you doing it if you're okay with that.
Yep, I'll make your job easier.
Thanks, James.
Good evening, everyone. I'm Dr. Davis. I'm the health officer. I work with Kelly at our health department in Long Beach for the city of Long Beach. And my pronouns are she and her. And we're going to do a deep dive into COVID-19 vaccine and hopefully answer some of your questions. I just want to know how I will know if I'm speaking too quickly or if I'm speaking at the right speed as far as translation goes. Is there a way for people to let me know, or do I just like do a thumbs up?
We can send you a message on your chat.
Okay, that sounds lovely. All righty. So go ahead to the next slide, please. So to begin with COVID-19 vaccination, the big question is, why should I get vaccinated at all? And the primary reason is to protect yourself and your family from hospitalizations and deaths, especially among communities of color. As it's been mentioned, we are at higher risk of being hospitalized and suffering serious consequences and dying from COVID-19. So that's the first reason to get vaccinated. The second is to help stop spread in the community. The more people that are vaccinated in the community, the less people that are available for the virus to jump to infect. And then it's also important to set a good example for others, including your friends and your family, coworkers, and the community at large. Next slide. So some common questions that we will address in this presentation is, how do we know that the vaccine is effective and safe? Why should we trust the vaccine? Is there new technology being used, and is that dangerous to me? What is an EUA, and what does that mean for me? When and how long will I be protected? Will I still need to wear a mask? What are the expected side effects? What if I've already had COVID-19? What does that mean for vaccination? And where should I look to get accurate information? So those are some of the things that we'll be reviewing tonight. Next slide, please. So are the COVID-19 vaccines safe? Safety is the most important part of vaccine approval. So that's kind of the primary, if the vaccine isn't safe, it really doesn't go any further into the process. For the COVID-19 vaccines that are currently authorized, most side effects happen within 6 weeks of vaccination. The FDA, which is the Food and Drug Administration, requires 8 weeks of safety monitoring when testing the COVID-19 vaccines. And they're actually following people for several months after they get vaccinated with this vaccine. Next slide, please. So some of the things that, that are occurring to ensure the safety of the vaccine. So even after the vaccine has been authorized, we are still continuing to check for safety as the vaccine is used in the public. And to make sure that a vaccine is safe, the FDA usually wants at least 3,000 people in the trial. And for the two COVID-19 vaccines that are currently authorized, those trials included actually tens of thousands of participants, so way over the 3,000 minimum that the FDA wanted. Next slide. So how effective are the COVID-19 vaccines? So, so there's two COVID-19 vaccines right now that are authorized to be used in the United States. So one of them is the Pfizer vaccine, and then the other one is the Mrna vaccine. And they both have about a 94 to a 95% protection from having a symptomatic infection. So they provide 94 to 95% protection against protecting you against having a symptomatic infection. And they saw these similar outcomes, no matter what your age, your ethnicity, that you still, everybody was at about a 94 or 95%. Next slide. So who is included in the COVID-19 vaccine trial? So there were tens of thousands of people. So for the Pfizer vaccine trial, it was over 40,000 people in the trial. And for the Mrna trial, it was over 25,000 people in the trial. And these trials went for 2 months for each of them. And they were both, you know, were pretty racially diverse. So the Pfizer had a 30% racially diverse trial participants. 10% of the trial participants were African-American or Black, and 13% were Hispanic. For the Mrna trial, it had a 37% racially diverse participants, with 10% being Black and about 20% being Hispanic or Latino. And then for older adults, the Pfizer trial had 45% of adults who were between the ages of 56 and 85 years of age. And the Mrna trial had 23% who were over 65 years of age. So historically, many clinical trials have been mainly middle-aged, very healthy white people. So I feel like these COVID-19 trials really tried to have a diverse group of people around different ages and ethnicities. Next slide. So why should we trust the COVID-19 vaccine? So one reason is that the FDA is using the same strict standards for these vaccines that it has for decades. No steps were skipped. Next slide. So 2 independent expert committees review the results of the trials, and members of these committees have no conflict of interest and they're not associated with any vaccine companies. The Vaccine and Related Biological Products Advisory Committee advises the FDA, that's one of the committees, and then the Advisory Committee on Immunization Practices that advises the CDC. So in order for these 2 vaccines to become authorized, they needed to go through those 2 steps first. Next slide. So what is an EUA and what does that mean? An emergency use authorization for a vaccine is based on the need to use a vaccine quickly to save lives during a public health emergency. An emergency use authorization, or an EUA, is a shorter process, but no steps are skipped in the safety evaluation process. The FDA makes sure that the known and potential benefits outweigh the known and potential risks. And 2 separate advisory boards, the VRBPAC and the ACIP, also review the data and make recommendations. An EUA does not mean that the authorization was done too quickly or that the vaccine is not safe. It just means that we're in a public health emergency, and so the benefits of the vaccine outweigh the risks of dying from COVID. And right now, everything that's happening around COVID-19 is under an emergency use authorization. So all of the testing that's available now, all of the treatments that are available now are all under EUA because we're in a public health emergency. And so the goal is to save lives quickly. Next slide, please. So how was the vaccine able to be developed so quickly? So the major reasons why the vaccine came to market, or came to be able to be used a little bit more quickly than usual was that, again, it was a global effort with the world's leading scientists all focused on this single task. So it wasn't just, one company over here and one company over there who was also doing numerous other things. Everybody was very focused on one goal. There was also nearly unlimited resources put into this effort. So money, knowledge, people power, technology. So that was very helpful to have this focus. And then a large group of adult volunteers from many ages and ethnicities participated in the trials, and that's been really important as well. Next slide. So a little bit more about these 2 COVID-19 vaccines. They're both mRNA vaccines. One is Pfizer and the other is Moderna. Those are the vaccine companies that made them. mRNA is not short for Moderna. It's instructions that make proteins. They don't contain the COVID-19 virus, neither of these vaccines. The Mrna vaccine, just a fun fact, was developed by Kizzmekia Corbett, a PhD for the National Institutes of Health. Next slide. So mRNA technology for these 2 vaccines is a new type of vaccine, but it's been studied for more than 10 years as possible treatments for cancer and also to develop other types of vaccines. The COVID mRNA vaccines tell our cells how to make a harmless piece of protein. The protein is something that you do see on a COVID-19 virus, but it's not from the virus. Like, no part of the virus is in this vaccine. The spike protein, however, is found on the surface of the COVID-19 virus. And so our body knows that this spike protein shouldn't be there. And so it'll make antibodies and an immune response that will fight COVID-19 if you should come into contact, if you should be exposed or be around somebody who is carrying the virus. Next slide. When and how long will I be protected? The 2 vaccines currently are available as 2 doses, either 3 or 4 weeks apart. You can give these vaccines up to 6 weeks apart if you need to. Full protection occurs about 2 weeks after the 2nd dose. Right now, we don't know for sure how long the vaccine will work once we get it. The thought right now is that the immunity that you get from either of these 2 vaccines lasts for at least 3 months, but we'll know more as we follow more people who get the vaccine. And you may need to have booster shots for COVID-19 on a regular basis, just like you'd need to for the flu shot. So time will tell as far as that goes too. Next slide, please. So, do you still need to wear a mask and stay distanced? Yes. So similar to other vaccines, a large number of people in the community will still need to be vaccinated before transmission drops enough to stop the use of masks and staying physically distant. So because this is a new virus, it's a new vaccine, we don't know how long the immunity lasts. And, it's very important that, because we don't, we know the data or the results and what happened when we did a study in a clinical trial, but now we're using it in the real world. It's very important that everybody continue to wear a mask and to stay distanced for the next several months until we get more information about how long the immunity lasts as we're vaccinating more people. So yes, you still need to wear a mask and you still need to stay distant. This is just the vaccine. It's another level of protection, and it's just more assurance that you're not going to end up being hospitalized or having a really serious infection from COVID-19. Next slide, please. So what should you expect? So the vaccine cannot give you COVID-19. The vaccine only has just a little part of instructions of that little spike protein. It doesn't have anything else in it. And so there's no way that it can make you sick or give you COVID-19 or any of that. You can expect to have some short-term discomfort after you become vaccinated, such as pain at the injection site. You may have fatigue or feel tired, headache, muscle pain, muscle aches, chills, or fever. These reactions will last for 24 to 48 hours and are more common after the 2nd dose. And the side effects means your body is doing its job and making antibodies. And these side effects are normal and they're common and they're expected. Next slide, please. So will the vaccine protect against new variants? Early testing is showing that both the Pfizer and the Mrna vaccines seem to work against the new forms of COVID-19 or the new variants that are in our community. And we will keep studying, scientists will keep studying all vaccines to make sure that they work against the new forms of COVID-19. This is another reason why it's important to continue to mask and distance, because we don't know what kind of mutations the virus may have in the future. Next slide. So you need to get the 2nd dose because you don't get full protection until you get both doses of the vaccine. It's important to get the same vaccine because, again, that's what was studied in the clinical trial. So if you started with Pfizer, that's what your first dose was, and your 2nd dose should still be Pfizer. And you should not get any other vaccine, such as flu vaccine or shingles vaccine, for 14 days before or after your COVID-19 vaccine. And you know, again, that was part of the trials. They didn't give other vaccines around that time. And then, you know, if you have side effects, we know where it's coming from. Next slide, please. So what if you're pregnant or breastfeeding? So there's limited data right now about the safety of COVID-19 vaccines for people who are pregnant or breastfeeding. Mrna vaccines are not thought to be a risk to the breastfeeding infant. And there are studies that are being planned to follow and monitor pregnant women and women who are breastfeeding. So it's important to talk to your healthcare provider about the risks of exposure and potential risks or benefits of the vaccine. But women who are pregnant or are breastfeeding are eligible to get the vaccine. Yeah, next slide, please. So right now, children are not eligible to get vaccinated. We need to still measure vaccine safety and efficacy in each age group. And so far it's only been for adults. So testing hasn't started yet, but there are plans to start testing children 12 to 17 for Mrna, and for Pfizer, those over the age of 12. And hopefully sometime during the summer maybe, or the fall, we'll start to have a vaccine that would be ready to be used in children. Next slide. So what if you've already had COVID-19? Should you still get vaccinated? It is safe to get the COVID-19 vaccine, even if you've had COVID-19, but you should wait until you feel better and until you're out of your period of isolation when you need to stay in your home, which is 10 days. And even if you've had COVID-19, it is still important to get vaccinated if you have that opportunity. It could give you better protection, maybe protect against more types of the virus. And even if you have positive antibodies, you should still get the COVID-19 vaccine. Next slide. So where to get accurate information? So it is very important to get information from reliable sources. A lot of people have a lot of different opinions, and so it is helpful if you rely on accurate sources. So those are places like the Centers for Disease Control and Prevention, otherwise known as the CDC, AMDA, medical directors, and providers. And social media does have a lot of misinformation and opinions, and so it's important just to go to the source. So some information sources that you can use are the Long Beach Department of Health and Human Services. We have a lot of information and links. The California Department of Public Health, and the Centers for Disease Control and Prevention. So if you do any kind of Google search, like if you have a question and you just put that question into the search and just put CDC on the end of it, then it'll bring you an answer that the CDC is giving. Next slide. So vaccines are a key way to control the COVID-19 pandemic. You know, we still need to keep doing everything else, all the other ways that we control the pandemic: masking, distancing, avoiding crowds, not gathering, not staying indoors with people outside of your household, washing your hands. Those are all still very important. And vaccination just adds another layer of protection on top of all those other things that we all should be doing. So we all have to get vaccinated to do our part, so that eventually we're able to get back to being able to have schools and businesses open, being able to be more social. I believe that's it for me. Thank you.
So thank you, Doctor. I wanted to just share a little bit about the vaccine efforts going forward. And so, you know, just there's been a lot of interest about how it's determined who gets vaccinated when. and where in the city are those decisions made. And so we'd like, the key piece to understand is that the decisions on the tiers of who gets vaccinated when and sort of when it's your turn has been established by the state. So the state in its first tier said, anyone who is a healthcare worker, and those were healthcare workers in hospitals, which was the starting point, and then also in clinics, but also fitting in there are community health workers, promotoras, and others to be able to do that. And we've been working to provide vaccine opportunities within the community. The next tier started with those who are 65 and over. So a very strong focus on our older adults within the city, as well as food service workers in agriculture, educators, and emergency services workers. So those are the only tiers right now who are eligible to be vaccinated. And they're really based on risk. And so when we, based on that focus, so if you're a healthcare worker and you're in a hospital setting or a clinical setting or with patients or in the community doing outreach, you're at more risk because of your interaction than maybe others. In terms of older adults, we know that older adults, when we look at who is being hospitalized and who is dying from COVID, most of those folks are over the age of 65, at least in terms of the deaths. Those being hospitalized can be a little bit younger. And then we look at, who is really interacting a lot with the public. And so food service workers, restaurants, grocery stores, bodegas, farmers markets, and others. So, we start to look through that, and then the educators. And while many educators aren't back in the classroom yet, we know it's very important to get them back into the classroom. And we're working really hard to ensure that when they go back, that they'll be safe and ready to be, with your kids and educating and going forward. And so that's also a focus. So those are how the decisions are made. And the initial really push from the state was move as quickly as possible to do as much vaccinating as possible, really focus on your healthcare workers and those over 65. And that's what we've done as a city so far, and really through the month of January. So we did a whole lot of first doses during the month of January with those populations. But what that also means is that when we look at our equity metrics and we're looking at who's getting vaccinated, that there's a far overrepresentation among white folks within our city than among others. And much of that is because when you look at the proportion of our city who are over the age of 65, 55% of them are white, which is far larger than you see as a proportion of anybody else within the city. But we've vaccinated 58% of our older adults, and that after that first push and the second dose push that we did in February, it's really given us an opportunity to think about now, how do we really start to think differently about how we're reaching out? How do we really start to think differently about how are we in community with people and connecting with people who don't have digital opportunities? One of the fastest way to get appointments out is through people who can access their technology, and the key appointment makers require that people enter their information into technology. And so we're really stepping back and thinking differently about what are our options and how do we start to really make sure that we are engaged within our communities where all of those things may not be as easy. The timeframes are different, the ability to register is different. Having a telephone, having an email address, all those things differ across our community. And the large scale that went first really relied on that. So we have created a vaccine task force. It's a subcommittee, includes many community-based organizations who are living across the city and engage with people living across the city, as well as a number of our different departments. And we were able to fund 5 nonprofit organizations through the Public Health Institute to really do outreach. And we focused their efforts primarily on the areas where we saw our highest case rates. So where the vaccination rates are and the case rates, they don't match either. And so we have some census tracts that had just much higher case rates than others. And so they're funded to really educate, provide supports, help people enroll in vaccine and everything. So that is started. We do have a multilingual digital outreach toolkit We're creating our notification systems in multiple languages. We answer phones in multiple languages, but that's just the starting point. And so really what we are looking at doing is moving forward is creating much more consistent, they'd be smaller clinics. So right now, most of our vaccine happens at the convention center. So, you know, we, through the sort of setup at the convention center, we did close to 5,000 people last week at the convention center, and it'll, you know, so we can move a lot of people through. But if you don't have a car, you don't have transportation, or you don't have a computer and you haven't been able to enroll, the convention center is not always your easiest way to be vaccinated. So we do intend in the month of March to really put together a much more focused plan around the communities with consistent, localized vaccine opportunities, you know, some in language, making sure that we have a lot of different supports, working with our community-based organizations to help support people in the enrollment process. So getting the appointment, signing up for the appointment, and then also following up for the second doses. And then also we have a number of senior buildings and others who, you know, we do through a mobile is that we would go and start to vaccinate some of our senior buildings, as well as the opportunity for people who are homebound to be able to bring the vaccine to them. So we have a lot of things in the works to start to address what we know is the inconsistency between where the most impacted and those who are being vaccinated, to really make sure that we're refocusing. So with that, we can answer questions now, James, or do you want us to wait till the end and we'll turn it over to Juan?
Cool. We can go ahead and transition into our panel. But thank you so much, Kelly and Dr. Davis, for these are definitely important information for our communities, and the awesome presentation and the awesome slide y'all were able to share with us. So now we're going to be transitioning into our panel, and we know that folks have tons of questions. So our communities have submitted questions. But before we go into questions, definitely want to give our panelists 3 minutes to do a quick introduction. Again, your name, your pronouns, and share any updates that you have around COVID and within your work area. So we can have Dr. Juan Benitez start.
Hi, it's saying on my end that I'm not able to start my video until the hosts give me permission.
Okay, we'll go ahead and support with that.
Thank you. Hi, everyone, and thank you for hosting this. I'm Juan Benitez. I'm school board member for Long Beach Unified School District, and I represent Area 3 or District 3 in our school district, which is downtown Long Beach and parts of central Long Beach. So quick 2-minute update. Our district, in concert with our city, and thank you to our public health officials that are here from our health department, started a couple of weeks ago providing the vaccine for our elementary school certificated and classified employees. That's in concert with our reopening of in-person instruction that is expected to happen on March 29th of next month. So we wanted to make sure as a district that we provided the opportunity for all certificated and classified employees to receive both doses of the vaccine before students would return in person on March 29th. In addition to that, we are also beginning, starting actually today at 4 o'clock, to set up appointments for all of our 6th through 8th grade level certificated and classified staff members. They'll be able to receive those vaccinations starting Tuesday and Thursday of next week. Again, thanks to our city and our public health officials. There will be a vaccination clinic held Tuesday, Thursday next week at Cabrillo High School from 2 to 6 p.m. So I encourage all LBUSD employees to check their emails. An email went out today at 4 o'clock so that everyone that wishes to get the vaccine has an opportunity to do so. And I can talk a little bit more about our phase-in plan in relation to COVID and answer any questions that anybody has but we're moving fully forward for those parents and households that chose in-person instruction to be able to do so starting March 29th. Of course, any parents and households that prefer to stay online for instruction, that will still continue. Right now, we had a little less than half of the households in our district choose the in-person option, and we'll begin the phase-in of in-person instruction, as I mentioned, beginning March 29th. And then again, if our numbers stay low, then there is a possibility for us to then move with our middle schools and our high schools, but it just depends on our case rate.
Thank you, Juan.
Okay. And then Kelly, if there's any updates around COVID-19 or vaccination, or even the process, feel free to introduce yourself again, pronouns, and then your role, and if you want to share any updates.
Are you asking? So I think I have shared most of the updates. I think, so again, Kelly Colopy, Director of Health and Human Services Department, she, her. So I think the one other key, not so much around the vaccine updates, but the COVID update, is that our numbers have dropped significantly. So I think something for all of us to understand is when we were at the peak in the middle of January, our case rate was 160 per 100,000. It's now 14.8 per 100,000. So within the last month, it has dropped just substantially. And the same, our positivity rate topped out at 17%, and it's now at 4.9. So all those numbers. So as we're talking about the school and the ability to come back at the school district, is to really understand that, you know, the elementary schools are based on that the case rate is a 25 or below. But then the middle school and the high school, we need to get down into the tiers where we are at 7 or below. And so while all the numbers are going down quickly and we're really excited, there's a lot of things. We know people want to move forward, and we want to like start opening things. So that number 7, when you're looking at the data, so I put in the chat. So it's longbeach.gov/COVID-19. There's a dashboard there, and that dashboard gives you all this information. And it's the first place I look every morning to see where things are. And so you'll be able to see that, like, as it's trending, where we're going to be. So I think that that's really an important thing to work for. So we're continue to be in the most restrictive tier, but I do know that in the future that, you know, we'll be working towards moving into the next tier and more openings and more ability to be together.
Great, thank you. Dr. Davis?
Okay. Anissa Davis, the City Health Officer for the City of Long Beach, she and her. Are you able to hear me?
Yes, we can hear you.
Okay, wonderful. No new updates. I think, you know, Kelly covered it. We're getting better. We're not, you know, where we were yet. So I think, you know, we're have some really good forward momentum going, some good improvement. And so I think it's just really important for us to continue wearing our face coverings and doing our distancing and washing our hands, so we can continue to get better and better and better and get more and more things open. And it's really exciting that our schools are going to be able to open pretty soon. So that's it for me.
Awesome, thank you so much. And thank you again for being here today. So we have a lot of questions that were submitted, and we know that we want to do the best we can to get through all of the questions that were submitted. So let's get to it. So this question is for Dr. Juan Benitez, and Kelly and Dr. Davis, feel free to also respond to it too if y'all have anything that you want to add to that. So the question is, I heard that all students need to be tested once a week. Who is doing the testing? Will I be notified if my child is exposed at school?
Yeah, so to thank you for the question. I think there's two questions there, and yes, if you did choose the in-person instruction option, beginning with our TK through 5th grade, which is our elementary schools, the plan includes weekly testing, and it's asymptomatic testing. It's the anterior nasal testing, which is the front part of the nose, will be required for in-person. In terms of how that test will be done, it's really going to vary school site by school site. At some school sites, some students and parents chose the in-person option higher than at other school sites. So there will be flexibility in how that test will be done depending on school. So just to give you an example, there may be schools with hundreds of students that chose the in-person option, and they're larger schools versus other schools that are smaller schools where half of that number chose the in-person option. So those plans and details, each school will have specific details. I encourage everyone to contact their school, and in the chat, what I'll do is I'll post every single school site's phone number because each school will have a very specific detailed plan, not just for the testing, but for all the protocols that will go along with the in-person instruction. I've also posted our LBUSD Schools Opening and Safety Plan in the chat as well. There's a link there, which is a document that covers a lot more detail than what I'm able to cover tonight. But I think I answered, Amy, did I answer both of the components of that question?
Yeah, you did. Thank you. Awesome. So we can go on to the next question. So we want to be able to acknowledge that students with disability may have challenges when it comes to COVID testing. So for instance, like these weekly testings, right? It may impact their mental health and even challenges of taking the test. So our communities are asking is the nasal testing the only option? What are the weekly testing going to look like with COVID-19? Do we have other options for students that might be impacted and are impacted by disability?
Yeah, so right now, my answer would remain the same, that yes, we are going to require in-person asymptomatic testing for anyone that's going to come to one of our campuses. But again, the details of the plan, we're looking into the flexibility per school site level. So as an example, there may be several entrances at each school site that will allow for testing to occur to accommodate, right? So that we don't have a backup of hundreds of students in the morning at the school sites. And we're also looking into the possibility of parents helping to administer those tests. So I would encourage everyone to, again, read the detailed plan that I posted, but also contact your school site. We'll be having a series of two-way communication by school level. I would encourage parents to be vigilant and contact their school for the specifics as to how the testing and, again, the in-person instruction will occur. I just posted in the chat let me do that right now, the contact information for each of the schools, but the schools specifically, so if the neighborhood school in your area is Chavez, for instance, Chavez is receiving all of the details starting next week. Each school will be providing two-way communication opportunities for parents to ask questions, just like that.
Great, thank you, Dr. Juan Benitez. So this question is for the panel. So there are young adults with disability that are in high risk category. When will they be prioritized for like vaccination, yeah.
I think that, so the way that the state is currently looking at their tiers is that they have added a sort of a next tier, ages 16 through 64, with very specific underlying health conditions. And so those can be found on our website as well in terms of what those are. At this time, that's the only priority based on any sort of medical condition or anything other than age or business sector. we're not clear where that next step is. We don't always know the timing of when the next sector becomes available or anything. That's really established by the state, and then we work to follow those guidances.
Great, thank you. So we have some more questions on the chat is, how can we best support communities such as African American who have a long and violent history with medicine and the healthcare industry? Folks have experienced African Americans of all ages and class backgrounds stating that they do not think they will benefit from this. How do y'all respond to that? And how we can best support?
I can start a little bit. I think one of the important things is being transparent and open and honest about the information that we're sharing, and being very just knowing the context and knowing kind of the history, the legacy of the healthcare system and its effect that it's had on people of color, and then the actual kind of systemic, inequalities and implicit biases that affect people of color in the healthcare system today. So I think that that's really important. And then, and to have ongoing conversations such as these, I think that that's important too, because I think that it's not like a one-time, I'm going to give you all this information and then everything's going to happen. It needs to be ongoing. And I think just, being ready when, answering all the questions, and then being ready when the person is ready. And I think also, in this pandemic, for me, one of the things that's been really important is when I look at my community and I see who's dying, and I see that people aren't dying from the vaccine, but they are dying from the virus, and wanting, the people in my life and my community to be there for their grandkids and their kids and their brothers and sisters and what have you. So that I feel like is important.
Can I add, Amy, just to build on Dr. Davis's point, that for our school district, the transparency and communication piece is just as important, particularly because we are dealing with both adults and students and children in our school district. To give an example, we have had about 1,600 early care and education students in person since this summer, right? And these are our youngest children, in some cases babies and 2 and 3 and 4 year olds that may be in households that are multi-generational households. So the added layer for our school district is that we also need for the information to be accessible in multiple languages, right? We have a large Khmer Cambodian community in Long Beach. Out of our close to 70,000 students, 55% of them are Latinx community members, about 12% African American. So in total, about 87% of our students are students of color. And to highlight Dr. Davis's point, 2/3 of our students are either on free or reduced lunch, right? And we know the qualifier for that is income. So we're really talking about 2/3 of our students are low income students, which historically have not had access to the best healthcare in our country, in our neighborhoods. And there is an inherent natural distrust, right, given the legacies in communities of color. So I think the most important part to me, as Dr. Davis said, is building trust, being transparent, as Kelly Colopy said, providing as much information and education to our community members in order to save lives at this point. So I'm encouraging everyone I know that as soon as they're able to, get that vaccine, right? And so I think the challenge now is, one, having enough doses for everyone, but also providing opportunities like our city and health department have been in neighborhoods that historically haven't had access to high quality health care and our health system. So this is an opportunity for us to pivot and address many of the equity issues that have haunted us in the past. So our district is fully committed to doing that.
Thank you for that. So let's go on to the next question. So it says, for seniors who are already eligible, who are hesitant because transportation challenges, would you recommend them wait for the 1-dose vaccine?
So in general, from a medical standpoint, this is Dr. Davis, if you're able to, if you're eligible and you have an opportunity to get a vaccine, in general, I never recommend waiting. Like, I always feel like if you're able to get it, you should get it. And we are working on ways to overcome the barrier of transportation. So including being in neighborhoods and then helping with transportation in other ways. If there's just no other way, like there's just nothing else you can do and you feel like the only thing you can do is wait, you know, I think that 1-dose vaccine will be coming pretty soon. But I hope that we would be able to help with that barrier instead of having you wait, if that's like the only reason.
And then we also intend for people who are homebound and where travel is difficult. And so is to start a program. We've done it similarly for COVID testing, where you can sign up and we make appointments and then we actually come to the household if people are, you know, it's very difficult for transportation. It's not fully in place yet, but we're hoping, you know, within the next month that will be in place and people can sign up to be able to access that. And then those living in senior buildings that were not already vaccinated through the HUD program with the pharmacies will also be doing the same thing with them and reaching out to the owners of those buildings to set up appointments. There was a question in here about, you know, do we have enough vaccine for everybody who is eligible? No, we don't. You know, we think that there's probably, that if you count all the people who are currently eligible, it's about 100,000 people within the city. If you're continuing those who are 65 and over, healthcare workers, food service, educators, everybody, there just hasn't, you know, there hasn't been enough. So, you know, when vaccine first started rolling out at the state level, the whole state was getting about 460,000 doses. So that's what came into all of California. And we're a state of, I don't know how many, there's so many millions. And so, you know, we were getting maybe 2,000 doses a week at one point. We're now getting maybe 8,000. It's just bumped up a little bit, like the distribution is better. So we're getting maybe 8,000 doses a week now. And so that allows us to reach out more. So we are making progress, but there isn't at any one time enough. And the other key piece is that there's a real push from the state that when vaccine arrives to move it quickly. Like the point is to make sure people get vaccinated as quickly as can. And so, you know, that we don't want anybody sort of waiting to see if we have enough. So our point is always to make sure that we vaccinate everybody we can as quickly as possible, and then to be able to follow up with the state to make sure everybody gets their second doses. We are hearing that we may have the Johnson & Johnson may be available as soon as the next week or two to be able to start if it makes it through all of its process. So that's not that far out. Once again, it's not being distributed at the same level as the others quite yet. There's going to be a lot going on there. So it's one more option that we'll be able to rely on, you know, certainly within the month of March. So we're looking forward to that as an option for folks. It's been found to be just as effective in terms of people getting seriously ill, hospitalized, or dying from COVID. And so those are some key areas that we've really focused on.
Okay, thank you so much. So we have a lot of parents joining us tonight, and a lot of questions are coming in around schools. So I definitely want to keep this in the panelists, and I believe that this question is actually for Dr. Benitez. So it says, community member wrote, I read that it is more likely for teachers to spread the virus, not students. Will the school district reassign a teacher if they refuse to get vaccinated? And then just following with they will still be able to teach since CDC guidelines say that they can? What does LBUSD say?
Yeah, great question. So at this time, we're not requiring, and it's not just teachers, right? It's our librarians, our school psychologists, our nurses, our classified employees. And so we're not requiring our employees right now to get vaccinated. In terms of, I think I missed previously, there was a question asked in terms of our students with disabilities. So again, we are going to be as flexible as possible, but we are requiring weekly testing of students, and it's asymptomatic testing, right? Whether you have symptoms or not. There will obviously be other protocols in place, but again, we need to hear from our community members right now about what their concerns are, what questions they have, given that our executive staff and our school site staff want to be as flexible and as conscientious as possible. So I put the link in all languages, in Khmer, Spanish, and English in the chat again, but we're not requiring, our district is not requiring for our teachers and other school site staff to be vaccinated.
Okay, thank you. So next question, if I've been vaccinated and my friend has been vaccinated, can we hang out without masks?
Not yet. So, you know, there is language that allows gatherings of 3 households. So, so you can kind of decide, if you choose to, that this is your kind of your bubble. These are your people that you hang out with. It would be better to do it outside. You still need to wear a mask. You still need to physically distance. And that's kind of where we're at for the near future, for the next few months. We will get to a point where we're able to be a little bit more up close and personal, but we're just not there yet. You know, we don't have enough people vaccinated yet. We don't know how long the immunity lasts. There's just a lot of things that we don't know yet. We don't know about the new variants and how they interact with the vaccine. Everything looks good so far with the variants in the vaccine, but there's still just so much we don't know that we really want you to continue to wear your mask, physically distance, not gather, kind of all those things. And then as things continue to get better, we'll be able to do more.
Cool, thank you. We got a lot more questions coming in. So as we switch the emphasis from testing to vaccination, how do we know the new infection numbers are truly represented?
So
We've actually,
yeah,
oh, go ahead, Doc.
I was just gonna say, like, so infection numbers. So if you have a positive test, that means you've been infected. I wasn't quite sure about this question, like what exactly they're asking, but if that's what they're asking, like, you know, a positive test is still indicating that you were infected. And so I would still believe the numbers of people who were infected.
So I think the other piece is that, you know, there's been this, there's this thought process that because we're focusing on vaccine, we're cutting back our testing, and we are not doing that. So we have the same hours, the same locations, everything for testing. Certainly the number of people who are choosing to be tested are going down because there's less in the community. So when they're not being as exposed as often, they're not, you know, they may not have the symptoms, those kind of things. So we saw the greatest amount of testing during the holidays. And we're pretty sure that was because everybody was testing before they went to see people to make sure that, you know, to think that they couldn't, that they would be safe to go to visit family members or something. And then they were testing often after they would meet with folks. So there was a whole lot of testing going on, but there's still the same number of appointments available for testing and others as we're going through. In terms of testing numbers, so at one point we were up to probably 3,500 tests a day, and you know, for a short period of time at the real crunch. Right now we're testing over 1,000 people per day. So that is capturing the actual cases. So if people are being tested, we're capturing those cases. And if we were only capturing those who felt they had were really sick, then our positivity rate would be much higher. Instead, people are still choosing to be tested, and the positivity rate remains low, which indicates to us that the general spread within the community is slowing down and is not as present. Doc, I don't know if you want to say anything more about that.
No, I feel like that covered it.
Well, so going back into testing questions. So when will we be prioritizing homebound people with disability? When will we be sending out vaccines, mobile units?
So in terms of testing, we're already doing that. We've been doing homebound testing for quite some time. People can make reservations on our testing website, and we're doing that. So that's the testing piece. In terms of the vaccine piece, we're in planning right now. We're hoping that by the end of March, that we'll have homebound testing in place. And then people will have the opportunity, just like they do for testing, they'll be able to go to the vaccine page and make an appointment through that. And then we would work to make sure that we bring the vaccine. It's a far different task to vaccinate somebody than it is to test somebody. It requires a completely different staffing protocol. You have to have very high, you have to be approved to be able to draw vaccine and to provide vaccine. Whereas for the testing, we didn't have to go through as much of that. So we are really putting all of that together. We have a lot of support to do that, and we're putting it together as quickly as we can.
Thank you. So I have a follow-up question for Dr. Juan Benitez. So will parents be informed if their in-person teachers chooses not to get vaccinated or the vaccine?
Yeah, because of privacy issues, no. We're not going to be letting folks know who took the vaccine or who didn't take the vaccine. But there will be, I think there was a previous question on the chat around will students and or parents be notified? So yes, our notification process is still general notifications will go out. And if there's an exposure to either student or any of the adult staff at the school, then they will be notified as well. I just want to remind folks too that the asymptomatic testing that we're talking about is self-administered, right? And it will be a combination of our school nurses, health techs, and other staff that will be there on the ground floor at the school sites to help with that. But that we are being flexible and they'll be there to support. There was another question about consent. Yes, obviously, we will need consent from parents and or guardians. We're not going to be just administering tests to students and children. Again, I would encourage folks to contact their school site. They're there now. Principals are there now, happy to answer questions. And each school will have very detailed instructions, information specific to that school as to the details of how that testing will occur at the school, where the entrances will be, where the drive-ups will be, who to direct questions to from both parents and students. Just wanted to clarify, right, that it will be a combination of school site staff, our nurses and health techs that will be there for support for these self-administered tests.
Great, thank you for answering those questions. So we also have here, so it says SB 932 LBGT data inclusion. When will we see these numbers in the Friday metrics?
I wasn't sure what the Friday metrics are, but I'm assuming maybe that it's meant the dashboard or the data that we have on the dashboard. And I would have to look into that. So SB 932 is a bill that was passed by the state, which requires voluntary reporting of sexual orientation and gender identity for everyone who is getting, I think for all communicable diseases, so that includes COVID-19. And our testing, we ask sexual orientation and gender identity, and then we also ask if you are infected, and we do an interview, we ask at that time. The numbers in general tend to be very low of people who report their sexual orientation and gender identity. But we are collecting that data. So I don't know exactly when that would be going on any of our local dashboards, and I can't really speak to the state and how they would put things there.
Okay, thank you, Dr. Davis. I have another question here for the panelists. It says, if communities of color is being affected the most from COVID, why are minorities not part of the tier system and vaccine distribution?
So I think one of the main ways that the tier system was built was by sector. That's kind of how it started. So by what kind of work you did. And if your work either, was taking care of COVID-19 patients or brought you into close contact with people who could be infected, like grocery store workers, that was really how the tier system worked. And then from there, it was age-based, because age is a very predictive factor. Being older than 65, you might, I think, be, less than 10% of the infections, but you'll be, greater than 60% of everyone who's dying from COVID-19. So there's a huge disparity. And then within that, really all of our jobs is to make sure that those people who are facing a disproportionate burden of disease, which is people of color, are able to take advantage of the vaccination opportunities. And so that's what we're working really diligently to do. But the state did not, and the federal government did not make it based on race.
Okay, thank you, Dr. Davis. So this question is for Dr. Juan Benitez. So this question is around reopening school. How is LBUSD plan for kindergarten and first grade in terms of class size and school time? So
Yes, it will be a reduced class size. And again, about half of the parents are choosing the in-person option, or chose the in-person option through a survey that we sent out. I also want to remind folks that it wasn't until last Tuesday that we actually fell under the 25 adjusted case rate to be even able to open up schools. So it's not, I'm not trying to be evasive or anything like that. It's just the details, again, wouldn't even allow for us to open up schools under the new guidelines. And so it wasn't until last Tuesday and that last Wednesday's school board meeting is when we were actually able to move forward on the plan. And we intentionally built in time. We didn't, go from Wednesday to Monday opening up schools so that we could provide more information and communication. I would also ask folks to look out for the outgoing communication that they'll be receiving both from their school sites and from our district level offices. So at this point, not all the details are out in the public, and that's why I think this forum is so important. Teachers will be back in their classrooms the week before students are coming back. So we're starting with TK through 5, right? We're starting with the lower grades because the adjusted case rate allows for us to start with that. Hopefully I'm an optimist here, we can keep our levels low, but we won't be able to open up at the middle school and high school level because the tiers are still there for middle school and high school. So to answer the question, TK through 5 right now will really depend school site by school site. And so again, I want to give a specific example of why I keep saying school sites. At some of our school sites, 3/4 of the parents chose the in-person option, right? Compared to at other school sites, and I'll be specific to schools in my area, the area that I cover in downtown and central Long Beach, a third or 40% of parents chose the in-person option. So the coordination and logistics looks very different when you have less number of students choosing the in-person option versus a greater number of students choosing the in-person option. And so that's why I keep referring back to the specific schools so that you could get the latest information from your school site staff as to how our implementation, yes, we have a district-wide implementation, but what that will look like may be different from school to school. And so a lot of that information will be on its way out beginning Monday of next week. So we're really looking at that first, second, third week of Monday to get as much communication out, receive and answer as many questions as possible. And then by the 22nd, that we would have their teachers back in their classrooms without students so that they could also get everything ready that we'll need for then students returning on the 29th. We were also intentional in the 29th date so that we could have a few days there before spring break, right? And then the following week is spring break, that first week of April, and then students would return obviously after that on the 12th. So our executive staff has been very intentional. We're not rushing this. We gave ourselves enough time to be able to do two things: operationalize a very complicated plan, continue to work very closely with our public health officials here in the city, but also allow ourselves time to answer questions, concerns. In Spanish, we have a word, inquietud, right? When you're not sure, you're a little anxious about things. And so we didn't want to do that to our students or to our parents. So we have time, right, to answer those questions, to address specific details and specific concerns, school site by school site.
Thank you so much, Dr. Juan Benitez. We definitely have a lot of parents on here that has these concerns, so we're happy that you all are here to help support with all of these questions folks have. So I actually have another questions around side effects. So the question is, since the vaccine targets the ACE2 receptor, will it have a long-term side effect relating to blood pressure in the future?
So the vaccine does not target the ACE receptor. The virus targets the ACE receptor. That's how the virus gets into our cells. The vaccine enters our immune cells close to where the vaccination is done, and that's where it enters those cells. It releases those instructions, the spike protein is made, and then that gets released and the immune response happens. And so this should have and then after all that happens, that instruction piece, the mRNA, which was the vaccine, gets degraded. So it gets eaten up and thrown, discarded. And so it shouldn't have any effect on your blood pressure. The vaccine should not. And we haven't seen that either from the studies.
Okay, great, thank you. So there's another question. So it says, do we need antibody testing to know our immunity?
So no. The antibody tests that are available right now aren't very accurate. So a lot of times, because different coronaviruses cause different issues, like some coronaviruses give you a common cold, the antibodies that you detect might be antibodies to that coronavirus and not to COVID-19 coronavirus. And so it's just not a good test. So we don't really recommend getting antibody tests for really any reason. So if you're an eligible person and you have a chance to get the vaccine, then we would just say get the vaccine and don't worry about any antibody testing beforehand.
All right, thank you so much, panelists, for joining us today. I know that you all had a lot of questions from community members that definitely are concerned and want to be in power when it comes to COVID-19 and the pandemic. So that's why we invited y'all here today, so that way y'all can best inform us. And we have a big group of participants. We have about over 100 participants joined us. Now we're at 81. So awesome. So now we're going to be closing out. So thank you again. We definitely appreciate y'all for answering the questions, and audience, feel free to send over any of the questions that you have. We're putting it together in a pile so that way we can best support the community and answering the questions for you all. So yeah, so just to close out, definitely our biggest call to action at LB Rising is that we hope you all were able to get the information that you all might have, or even spark questions, right? And have these conversations with your friends, your family, and your loved ones. Just know that there's definitely resources out there for our communities to have access to. If you haven't gotten tested and you need to go get tested, feel free to contact the number that was provided. Y'all are able to see the number and information on here, VaxLB, and also getting vaccinated. If you have any questions around getting vaccinated, the city has provided a number for you all to visit. So yeah, you all can also sign up to get notification when it's your turn to get vaccinated. And then the other call to action is that if you all feel like you need to visit any organization to support with looking for resources or information, feel free to visit longbeachforward.org and lb4.org, /COVID-19. And then you will see, you can find all of the COVID resources on the website for you all to look at. And then again, thank you, the community. We know that power is knowledge. If you are interested in reading more information around how has COVID impact communities of color and how has it played a role on race and the pandemic, feel free to visit racecounts.org. So you all can read more around how the pandemic has fueled race in our community. So again, thank you for having us. Thank you for being here. Appreciate you all. Hope y'all have a good Wednesday. We are out. Thank you.
Thanks, everybody.
Thank you, everyone. Stay safe.
Thank you. Thank you so much.
Bye.
Thank you.